Hello, I'm Dr. Mini Nair, founder and chief physician of Ayurveda and Siddha Hospital, 18th Main, Koramangala, Bangalore. Hyperacidity, or what we correlate to as amlapitta in Ayurveda, it is usually presented with conditions like heartburn or gas formation in the stomach, what we call flatulence, and in some conditions, heaviness in the chest region or in the abdomen. So when there are different kind of presentation, it can be both the acute as well as the chronic kind of presentations. So when people come with acute, the condition to be managed is in a different way, and when it in chronic conditions, we need to be managing it in a very different manner. So when we talk about cases of acute hyperacidity, first thing that we need to understand there is the agni or the pitta dosha that is actually in imbalance. So when you have an imbalance in pitta dosha, the digestive fire, what we call agni, is totally under a chaos. So we need to first correct it. How do we correct it? The first thing is the heavy to digest kind of food to be avoided completely. The heavy food items, when we talk about, it can be the milk and the milk products. So care to be taken to see that we should ask the person to just avoid milk in coffee or tea or alone as it is. Then second thing, when we come about advising about food, is we ask them to split the meals and take. The 3-course meals that we usually advise people to take can be divided into 5 or 6 times in a smaller portions, so that they are not heavy on digestion, and secondly, the constant supply of food keeps the stomach quite easy and to go light. The third thing that we can advise is certain other tips like to take coconut water. The tender coconut water help in easing the conditions, and there are other modalities that we adopt is through medicines. Medicines, it can be single choornas like ashtimadhu choorna or the licorice. What we advise, that with honey gives instant relief in case of hyperacidities. Then even the green coriander leaves, that around 5 to 10 ml of this green coriander leaf juice has always seen to give instant relief in cases of hyperacidity. There are even other conditions wherein you can advise amla juice, the gooseberry. The amla juice, but one thing that we need to be taking care of is never advise amla juice on empty stomach, but it can be taken after intake of food, around diluted with water. That gives also instant relief in case of hyperacidity. This was talking about all acute conditions of hyperacidity, but when it comes to chronic management of hyperacidity, the treatment modalities will just not be the tips alone. There are certain medications that we need to be incorporating to give the person a long relief from these conditions, because otherwise this affects the basic metabolism. On top of that, it can affect the day-to-day life also. So when we talk about chronic management in case of medicines, there are a lot of medicines that can be given to patients. That can be like indukantha grutahm, dakshadhikashayam, chirvilvadikashayam, dhanvanthram pills, and even certain Siddha products like pariharasindhooram, palagarepalpam. All this can be given in cases of hyperacidity to manage that.